3, 2, 1, go. I just had a thought, wanted to shoot this quick video as a reminder of why I'm doing the VNS. This morning I was moving some things, and as usual in the morning I take a dose of a 200 milligram tablet, and I started to move afterwards. I mean, I had a protein shake, which I do every morning. I take a pill with the protein shake, and then after that, you know, normally I'll go to work, and it may be here at my desk. Of course, this morning I was moving stuff from my storage building, moving it to the house, and that's what the little black stuff is. It's electrical tape. They're the best Band-Aids in the world. But anyway, I was moving this morning, and as usual, when I take a dose and right afterwards, of course, if I drink some water and I really get going, you know, a lot of adrenaline or the heart get it going. If I have if my medication is elevated, then I'm going to get toxic. And when I say toxic, I don't know what the exact medical term for it is, but for me it means my eyes cross so bad. And today they were crossed so bad. I was driving, the people behind me were following me, and I was driving, had one hand over my eye, and then had one hand over this eye, and I'm switching eyes because, you know, just one's depth, and one's for depth and one's close up, so I'm trying to figure out which one's which. So I'm driving there, and I'm drunk. I know I shouldn't have been driving. It was basically, I was DUI, what was going on. So I get to my office here and unload, and by that time I'm just totally looped, and it's I'm looking at the people helping me move, and I'm shutting one eye, and I'm saying, you know, I apologize. I said, you know, I apologize. I take medicine for epilepsy, and sometimes what it does is it makes my eyes cross. And I don't know if you've ever been toxic, and I don't know. I'll have to find out what the proper word of that is. If I don't know what it means to me, is I've just taken way too much medicine, or there's way too much in my system, or the therapeutic level is where it needs to be, but I just don't need to be real active, which it's kind of hard not to be active. And, you know, I'm not saying it does it every day, but days like today, it's just like, you know, being hammered and then having your hangover and then being sober. So by the time the afternoon comes, like right now, my head's fried, and I feel like I pulled, you know, I was just drunk, which I was this morning. So that's again one of the reasons that the VNS I'm getting that is hopefully it cuts down on the amount of medicine that I have to take. And again, it's real quick. I'm gonna kind of give a reminder to myself of why I'm doing this. You know, why I'm willing to risk. Not that it's that dangerous, but, you know, anytime you go into surgery, I mean, that's like a kid, you know, this poor little girl went into coma from tonsillectomy. I hadn't read a whole lot about it, you know, just saw the headline, that's horrible. Just horrible that would happen. So, you know, you do run a risk. Any doctor's going to tell you, you know, anytime you go into surgery, you're going to run a risk. VNS is pretty, there's not a lot to it. So, you know, it's I wouldn't, if you were planning to do it, I would not let that stop me if there was a chance of me reducing medication or reducing the amount of seizures that I had. You know, like I said, in '96 when I was having my brain surgery, then I was like ready. I was like, hey, cut away. You know, whatever you got to do, cut. So, you know, that was my mindset then, and it is now. You know, if there's a risk. There's a risk to everything. Go ahead, go for it. If you can get it, if you can afford it, if it's your insurance will pay for it. The Cyberonics, you know, if they feel like they need someone to give a VNS to, ask them. You know, say, hey, you know, I really can't afford this, but I want one. See what they say. It doesn't hurt to ask. So anyway, we'll talk to you later, and we are counting down. We're the 26th, so 27, 28, 29. Basically, I'm 4 days. What? 27, 28, 29. 4 days. 4 days away. I will probably check in one more time the night. I'll try to get to it the night before surgery and kind of give you a mindset and what I'm thinking. And then after the surgery, I can update, and hopefully I can get a better camera by then and just show you how minute the scar is. So, you know, it's something that, pardon me, it's very minute, and it's something that shouldn't bother you either if you're worried about that kind of stuff. It's not that big. So anyway, signing off for now. Talk to you in a few days. Bye.